The oral mech exam is a critical procedure for SLPs and provides the clinician with a wealth of important information. This presentation will walk you through the exam and all it entails. My name is Glenn Higginbotham, and our group consists of myself, Brianne Caswell, and Mariel George. The three of us make up Region 8 near Paris, Texas, and we hope that this presentation is useful for fully explaining what oral mech exams are and what they're all about.
Before trying to answer the how or why behind an oral mech exam, it's only appropriate to ask, what is an oral mech exam? Some other terms used in place of oral mech exam are oral motor exam, oral peripheral exam, and speech mechanism exam.
An oral mech exam, also called the oral mech, is an examination used to evaluate the structural and functional adequacy of oral mechanisms. This procedure is designed to take a look at the condition of the face, mouth, articulators, and other physical features that play a role in speech production. Differences in facial structures, motor planning, muscle strength, and other factors can have a major impact on speech and can be great information that an SLP can use when diagnosing a potential speech client. SLPs aren't the only ones who conduct oral mech exams, as it is commonly used by dentists and doctors for the same purposes. To get started with an oral mech exam, you will need some supplies. Common essentials for an oral mech exam include gloves, a small mirror to look inside the patient's mouth, a tongue depressor, a small flashlight, and a stopwatch. However, depending on the situation, it might be necessary to add things like suckers, cotton gauze, and other tools that fit the needs of the patient. We give a patient an oral mech exam for a variety of reasons. It is an appropriate procedure to give in cases when the patient has had a stroke, has feeding and swallowing difficulties, has a speech sound disorder, has a cleft lip or palate, or a motor speech disorder such as apraxia or dysarthria. In all of these cases, it is important for an SLP to assess the oral and facial structures and become familiar with these features of a client. The specific structures that a therapist would look at are the face, lips, teeth, tongue, jaw, the hard and soft palate, and cheeks. The following slides will provide a visual representation of what a therapist might look at during one of these exams.
This step is used to observe the client's overall head size, shape of the face, symmetry of the face, and spacing of the facial features. This can be an informal measure and observed during introductory conversations. Head, neck, and shoulder posture should also be noted in this step. It has been noted that there is some drooping of Jet's left eye. Observing the jaw allows the clinician to assess the size of the mandible in relation to the upper part of the face. Further, there was no deviation in Jet's jaw when opening and closing. The teeth can affect phonemes such as labiodentals and linguadentals. Any missing or gapped teeth should be noted in this step, as well as abnormalities relating to dentition. Lastly, the client's bite should be observed in this step. In this case, Jet presented with a Class 1 occlusion and had normal dentition. In this step, the clinician is observing the mouth at a resting position for breathing patterns, such as mouth breathing or not. Also included is the labial range of motion, labial closure and seal, and buccal strength. Any observation of drooling and clefts of the lip should be noted here. All lip observations are normal for Jet. This step is required to observe the size, surface color, completeness, and symmetry of the tongue, as well as smoothness and lateral margins of the tongue and any involuntary movements of the tongue at rest. This step also evaluates the range of motion and strength of the tongue. This may be done using a sucker and having the client try to touch the sucker with their tongue in a desired position, as well as applying resistance to the tongue with the sucker to assess strength. This may help with keeping the client more engaged and willing to participate if they know they'll get a sucker at the end of the exam. This observation will allow the clinician to note any thickness, tightness, or shortness of the frenulums to treat a lip or tongue tie. This step is important because it can lead to difficulty with range of motion, speech sound production, and feeding and swallowing.
We start by evaluating the pharynx by asking the client to say "ah" and stick their tongue out. With our tongue depressor, we gently hold the tongue down and use our flashlight to look into the back of the client's mouth. This allows us a better view of the coloring and structural build of the pharynx. We are able to look at the tonsils to see if they are normal, enlarged, or absent. At this time, we could also observe the client's swallowing and gag reflex. Here, we are observing the hard and soft palate. We begin by prompting the client to open real wide. We then checked the soft palate for any abnormal functioning of the velopharyngeal port, as this could result in hyper or hyponasality or difficulties with feeding. Along with the opening and closing of the port, we looked for scars, growths, discolorations, or clefts. If there was any discoloration, such as a blue tint, this would lead us to believe there may be a submucous cleft, and further evaluation from a physician would be necessary. Next, we observe the phonation of "ah." We start by prompting the child to say "ah" and use our flashlight and tongue depressor to gently hold the tongue down. During this movement, we are able to determine if there is any abnormal posterior or lateral movements. While phonation is taking place, we can establish if there is any hyper or hyponasality, and last, we can check on the normality of the uvula. This is my son, Jet, and he has helped Region 8 complete our oral mech exam. So to finish everything off, we are going to do just a little sample of our diatico-kinetic syllable rate. So Jet, I would like for you to say "p, p, 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 p." Good. And "t, t, 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 t." And "k, k, k." Good job. Okay, now we're going to put all of those sounds together and say "pedika, pedika, pedika."
Pedika, pedika, pedika.
Good job, buddy. Thank you so much.
You're welcome.